Good morning.
Good morning.
Apologize for being
Morning.
tardy. I was
Morning.
That's okay.
I was finishing up another webinar, so ran a little bit late because you know me. You get me talking and can't shut
I
me up.
know it. I know it. That's okay. That's okay.
Awesome. Well, happy to be here joining you guys. How's the weather there? Because it's about 40 degrees, cloudy, rainy. You know, it's just not good weather here. How's it down by you guys?
It's overcast. It rained all day yesterday, and it's a little cool. The temperature is, I'll tell you in a second.
Maybe you shouldn't tell me.
He's gonna laugh, everybody.
It's like
but,
83.
The temperature is 79,
Ugh.
and but it's a little chilly, I would say.
Okay.
Wouldn't
It
you
was
say
a good
better?
wind.
Yeah, it's got a little breeze. Good morning, Mary. I see you.
Awesome.
All right.
All right.
Hello, Heather. How are you?
I'm good. How about you?
Good, thanks. I'm great. Happy to be joining you guys. Yeah, if you guys could, we're about to get started here. I'll allow Julianne and Heather to do some introductions, but if you guys would just want to mute yourselves, just so we don't hear the background noise, that'd be fantastic. So that way, it'll just make for a better recording, and then you can turn your volume on, and we can have a conversation when we're done with the presentation. So just put yourself on mute just for the beginning half of this, and then after that, we'll get back together and answer questions and have a little powwow.
All right. So welcome, Dr. Osar. Dr. Osar is located up in Chicago and the Windy City, the cold city right now. And he is who Heather and I train under. So he developed and designed the integrative movement system through over 20 years of research and developing research. As we talked, Dr. Osar and his wife Janice, they research all of the time. The other important thing I do want to note is that they also have trained and continue training under the top two researchers for the female pelvic floor in the country. So what you would get if you wanted to explore that end of it through Heather or I is very detailed, state of the art. I hate using that kind of a term because it sounds kind of gimmicky, but it's the real deal. That's really the only way to say it. So, but that deep core system has been, is at the main heart of it, whereas traditional pelvic floor exercises and that sort of thing, they're kind of old school. So the integrative movement system is really based on Dr. Osar's research in conjunction with hundreds of doctors, surgeons, and like-minded healthcare professionals, and it is applied research. So he applies it, his wife Janice as well, on real life individuals. So we're proud and excited to have Dr. Osar join us this morning with his knowledge on the feet this morning.
Oh, we're talking about feet today? I thought you said lower extremity.
Well, yeah, you said happy feet, so whatever you want to do, take it away.
Thank you for having me. Thank you for everybody that's joining us here, because you guys are almost at noontime down there, so I appreciate you guys being on. And really what I want to do is make this very practical for you, because you know a lot of people are doing webinars and it's like, yeah, it's great information, but I want to make sure that you leave here with some practical strategies, and also to really appreciate the level of skill and knowledge that Julianne and Heather are imparting to you. And again, Julianne tried to downplay it a little bit, but I've been in the industry for 22 years, and I've studied with the best people in the world. The top, if you think about a pyramid, these are the people that are at the pinnacle of the pyramid. These are the people doing the research. These are the people applying the research. These are the people that Janice, my wife, and I go out and find and seek out and learn from, because it's important to us that we bring this information to our clients in our clinic, as well as our clients, or I should say the clients that we serve in the health and fitness industry, because we believe, I started out as a personal trainer. Just briefly, my story is I started out as a personal trainer. Then I went to chiropractic college. And when I got out of chiropractic college, I went back to personal training because one, I wasn't making much money, and two, I had a lot of time on my hands because I didn't have a lot of patience. But three, early on in my practice, I wasn't very effective as a chiropractor. So when I went back to personal training, I'm like, I'm actually doing better as a personal trainer than I am as a chiropractor. I'm like, what's the difference? I'm like, oh, I'm teaching people about posture and movement much more in my personal training than I was in my chiropractic practice. And that's really when my wife joined us in about 2000, joined me, I should say, in about 2000, our practice completely changed. Now it's chiropractic as I need to get people moving better. It's manual therapy as we need to get people moving better. It's the therapies that we do in our clinic to get people moving better. That's the ultimate goal. And that's why working with Heather and Julianne, I can't state the value that they're bringing to you and because you can't get this stuff. People write into us all the time. Do you have an integrative movement specialist in my city? And I'm like, we just don't have that many individuals that know this information and are using this information. So first, I want to thank you guys for all you're doing to help share the integrative movement system, and then also share this with your clients, because I know you guys, you're changing people's lives with this information. And I'm going to share some stories with you throughout this presentation as well. So let me go ahead and share my screen. Tell me once you guys see my screen. You guys got it? Cool. Okay. So healthy alignment, your foundation for life and longevity. Because what's great about our medical system here in the US, maybe you have some opinions about it right now and how they're dealing with COVID. However, we have the best medical system in the world, bar none. Now, having said that, we also spend more money on healthcare than anyone in the world. Having said that, you would think that it relates to better health results or health outcomes and longer life, and it doesn't. US ranks 32nd in the world in life expectancy. So we spend more money than anywhere else in the world, and we're 32nd in, I think it's 32nd. Yeah, I think it's 32nd in the world in life expectancy. So spending money isn't helping people live longer. And even if we're helping people live longer, it's not because of better lifestyle. It's because we know how to keep people alive longer with medications and surgery and life support machines. But that's not a better quality of life. And what I know Julianne and Heather are stressing to you, it's not just about living longer, it's living a quality life. And that's what I'm here to share with you, and how alignment can be a powerful part and is a powerful part of you living longer and healthier and remaining active. Because as we've also learned, the people that are surviving COVID are actually the people that are the healthiest, people that have good health. Primarily, the people that have great health. I just had a patient whose friend was 75 years of age. He got COVID, he went on the ventilator. Most people that age don't get off the ventilator. He got off the ventilator, he's been released from the hospital. And my friend said to me, she said, I believe what got him off the ventilator is he was in great shape. He always worked out, he was active. So if I can stress anything to you through this presentation is stay active. Please stay active in your house. Follow the guidelines that Julianne and Heather are giving you. And if there's anything we can do to help support you, please let us know that as well. Okay, now, one of the things we often hear, because we're going to discuss alignment of the lower extremity, we often think arthritis, and we'll talk about specifically osteoarthritis, is that your mom had bad knees and now you have bad knees, or your dad had bad knees and now you have bad knees, or your cousin had bad knees and your brother had low back pain, so now you have low back pain. So we hear that a lot, and doctors will often say that to you a lot. So if you're watching this and I can see you on the screen, just raise your hand if you've ever heard something like that. Yeah, awesome. Many of us have. Okay. Now, is it really true that because your mom had bad knees that you're going to have bad knees? We don't agree with that, and here's why. I see Heather and Julianne shaking their heads, so they already know the answer. This is my client that came in. Now this client, she's my age, so 50 years of age. She has left knee and big toe pain. If you look at her two knees, you can see her two knees basically aren't angling in the same position. They're not aligned in the same position. She doesn't have right knee pain. She's got left knee pain. Okay, so this is her standing. You can never really base anything on people standing alone. You just kind of look and observe. I'll show you another picture similar to this in a little bit. Now, one of the things we do, and I know Heather and Julianne have done this with you a lot, is assess you. Assessments help us. Those are our tools as integrative movement specialists to determine what is happening to your body when you stand, when you move, when you load your joints or put force and your body weight into your joints. So again, this is my client standing there with left knee pain with two legs on the ground. Now she's a runner. So we need to look at her not only when she's standing with two legs on the ground, we need to also look at her when she stands with one leg on the ground. So we have her go into what we call balance, single leg stance, stand on one leg at a time. So see her left knee? So that's her left knee when she stands on one leg at a time. Now, you don't need to be a physical therapist or a chiropractor or a fitness professional to see. Can everyone see? Just raise your hand. Can you see that her knee is not aligned there? Yeah, we can all see that. So we know that the knee, the hip, the knee, the ankle, and foot should be relatively in a straight line, not a straight vertical line. So it's not a straight line like this. It's basically a straight line like this, but you can see that her knee is not on that straight line. So when we think about body weight, so I want you to think about your body weight right now, okay? No matter how much you weigh, doesn't matter how much you weigh. When you stand on two legs, you have half your body weight on each leg. Makes sense, right? So if you weigh 100 pounds, when you stand on two legs, each leg is supporting about 50 pounds of body weight. When you go on single leg stance, when you stand on one leg, now your single leg is supporting 2 times your body weight. Because it was half when you were supporting on both sides. Now you go on single leg, now it's twice your body weight. So it's not supporting 100 pounds, it's supporting 200 pounds. So now look at my client's knee and just ask yourself, yes or no, is that a knee that you want to put 200 pounds of force through when you're walking or ultimately when you're running? And I see somebody's face, they're like, oh, no, not at all, okay? Now, remember, walking or standing, walking, twice your body weight. How much your body weight goes through your knee when you're running or walking faster? Now when you're walking faster, it's 3 to 7 times your body weight coming through your knee. So think about that for a moment. If my knee is not aligned and I'm putting half my body weight every time I take a step, or I should say twice my body weight every time I take a step, now when I walk a little bit faster, I'm probably putting more like 3 times my body weight for my knee. If my knee is not aligned, can you see how that could create knee issues? Does that make sense? So when your doctor says to you, oh, it's because your mom had bad knees or it's your genetics, what we really want you to understand, it's not your genetics. It's not your mom's problem. It's not your mom's fault, I should say. It wasn't your dad's fault. It wasn't your genetics. It's the alignment that you created somewhere in your life that led to these issues. Does that make sense? Cool, awesome. So 3 to 7 times your body weight when you run, and probably about 3 times your body weight when you're walking fast, or if you're trying to walk upstairs, which a lot of people have problems with, or walking downstairs. We'll talk about that a little bit here as we go as well. Okay, now, just in case you don't believe me, because sometimes people are skeptical and don't believe me, that's fine too, you can be skeptical. There's a research article, now we've been teaching this for years, for the last 10 years we've been teaching this, and nobody agreed with us. Everybody said, oh, it's because you're overweight. But guess what? We have just as many people that are skinny and fit that have knee problems as that are overweight and unhealthy that have knee problems. So it's not weight that causes knee problems. People say, oh, it's your age. Yeah, generally older people have more knee problems, but it's really not their age, it's time. It's time of non-optimal alignment that, like my client has, that will ultimately cause knee issues. That's why we have clients coming in here. We have 13 and 14-year-old girls that are already having hip surgery because they have osteoarthritic changes of their hips. It's not age. It's not age, it's not your weight. If it's not that, then what is it? So a Harvard researcher looked at skeletons, and what he noticed was, I should say, back it up for a moment, he wanted to look at why has there been such a dramatic increase in knee pain post-industrial. So he looked at skeletons. He found a grave of skeletons pre-industrial era. So around the mid to late 1800s, and then he compared them to skeletons in a grave they found after the 1900s, where people started to work sedentary jobs, standing on assembly lines, sitting at desks. So basically what Dr. Wallace came up with or concluded from his research of studying these skeletons and the structural changes they had to their skeletons, he said skeletons say arthritis isn't about aging, it's about activity. Dr. Wallace thinks the most obvious candidate to explain the increase in knee osteoarthritis is the modern decline in physical activity. And I want to add one thing to what Dr. Wallace says, because I do agree with it's the quantity of exercise, but I want to add one more thing. It's the quantity and quality. When we talk quality, we're talking alignment. And that's why Heather and Julie Ann stress so much the alignment, because there's lots of people like my friend Melissa that I just showed you in the screen, my patient, that they do a lot of physical activity. So they're getting physical activity, but they're still having knee problems. These young girls I'm seeing with hip arthritis are doing lots of physical activity, and they're still having osteoarthritic changes. It's not just the quantity, it's the quality. That's why what Julianne and Heather are teaching you is so important, because they're the only people out there, I shouldn't say the only people, the few people out there that are talking, it must be quality exercise as much as it must be quantity of exercise, okay? And all you have to do is think about food. Would you just, do you think Burger King is great food? I should say, well, you know that Burger King's not great food, right? It's awful food. But when you go to the store and you buy fruits and vegetables, preferably if they're organic and they're local, that's high quality food versus low quality food. There's high quality exercise versus low quality exercise. And especially now, if you jump on the internet, you know, Facebook, Instagram, websites, everybody's teaching exercise now because, you know, everybody's a fitness expert because they can be, because it's online. There's a lot of quantity of exercise out there. There's not a lot of quality of exercise out there. So please listen to your two specialists that you have in your community. Now, what about genetics? Because there is a component of genetics that you are born with. We're all born with certain genetics. So we do have to address that. Because somebody will often say to me, well, doctor, I have rheumatoid arthritis. Yes, that is, I will say, that is a sort of genetic component. So there's a doctor out of Cleveland Clinic called, or his name is Dr. Caldwell Esselstyn. He's basically the guy that, I don't know if you guys are familiar with, knives over forks. He's the one, he works in the heart clinic in Cleveland Clinic. He helped develop the whole program, Forks Over Knives, which is a vegetarian-based or plant-based program for helping people deal with high cholesterol and heart disease, essentially. And they've been basically able to solve and eradicate heart problems and cholesterol problems with a plant-based diet. So I love this quote that Dr. Caldwell Esselstyn said about genetics. He said, genetics loads the gun, your lifestyle pulls the trigger. We all have certain genetics, your lifestyle, and another word for lifestyle, it's your habits. It's the habits of how you choose to live your life. It's how you eat, the food you choose to eat, the habits you create around eating. It's the habits you create around posture, how you choose to hold your posture. It's the habits you've created around movement, the movement habits you've created that we've all created. Some help us, some hurt us, some are negligible. But the ones that cause osteoarthritis, those are actually hurting us and leading us to issues. So it's you have certain genetics, but it's also the habits you've created. I'll speak about my mother-in-law here briefly. Lovely lady. I love my mother-in-law. Obviously, I love my wife. And her mother, she did a wonderful job raising her two kids. And the thing she did not do a wonderful job with was taking care of her health. So now here she is, 75 years of age. She's severely overweight. She's had 17 knee surgeries. Not 7, 17 knee surgeries, including 2 knee replacements. She still has chronic knee problems and can barely walk to the end of her driveway, which is not very long. So it's not her genetics that caused her to have 17 knee surgeries. A lot of it is poor surgery and surgeons that weren't doing appropriate surgeries. We'll leave that aside for right now. But it's also her not taking responsibility for the habits that created the need for 17 knee surgeries, okay? So why do so many approaches to osteoarthritis fail? And what are some approaches? Because a lot of doctors, and again, there's some great doctors out there, don't get me wrong. We work with a lot of awesome doctors here. We're very fortunate, and hopefully your doctor is one of them. There's a lot of great people doing some great things. But a lot of doctors just passes off as genetics and will just throw anti-inflammatories at it, or non-steroidal anti-inflammatories, over-the-counter medications. And if you look at the research, almost all anti-inflammatory medications, do you know what the side effect of them are? Number one, kidney problems. Number two, inflammatory problems. So even though it decreases the inflammation, it actually creates joint degradation. It actually makes your tendons and ligaments weaker. So yes, it's a temporary fix, taking anti-inflammatories, but you have a side effect that it actually makes your joints weaker. So we have to be careful with medications. Surgery is an option for many people. I have a dear friend, Debbie, who had bilateral hip replacements. She came to me right when she basically was at the end and she needed a hip replacement. I had to be the one to tell her, I'm like, Debbie, we've done as much as we can. You need a hip replacement to get back your quality of life. But now, after her 2 joint replacements, she works with our integrative movement specialist, Sarah, to develop and build her strength because she went through physical therapy and still had trouble walking, still had trouble with stairs. So that's the importance of working with somebody like Julie and Heather. So why do so many approaches fail? Because we don't address, when I say we, our industry doesn't do a great job. Our industry being medical professionals, chiropractors like me, physical therapists, massage therapists, and most personal trainers don't change habits. They aren't qualified or trained to identify and change habits. And that's why Julianne and Heather are your go-to people, because they know they have a system of how to identify and modify your habits. How you're sitting will create and perpetuate issues. How you're looking at social media, how you're bending and lifting, how you're actually exercising. And I know if you've worked with them for any length of time, they know how to teach you how to squat and do things like that. Now, why address habits? Because just like your mother told you way back when you were a little kid, if you don't stop picking your nose now as a little kid, you will be that person picking your nose as an adult. And believe me, I can't tell you how many times I'm stopped at a stoplight and I look in the rearview mirror and I see the person in the car behind me just picking their nose because their mother probably didn't tell them to stop picking your nose. So again, we all have habits. What we want to do is identify and help you develop more optimal habits that create and help you develop more healthy joints or healthier joints. Okay. Now, what's the best approach to changing habits? It's the integrative movement system. And you recognize at least one of these individuals sitting in this picture here. And that's your good friend and your specialist, Julie Ann. And we're very fortunate to work with wonderful, amazing, passionate, kind, loving people who share this message and really have your best interests at heart. Now, why is alignment so important? Just one more thing. I think you're starting to get the idea of why alignment is so important. Now, think about when you go to take your car in to get new tires, for example. What do they always do before you leave the tire shop? Every tire shop does this. What do they always do when they mount their new tires? Before you leave, what do? They align and balance them. Because what they know, what the mechanic understands, is if your tire is not aligned, or I should say your axle on your car is not aligned and balanced, what happens to your tires? They get premature wear and tear. That's why alignment and balance is so important for your tires. Now think about the joints in your body. The joints in your body are no different. They need to be aligned and controlled because the mechanic knows when your tires are not aligned and balanced, you get increased wear and tear on certain portions of the tire, and you will, if the tire is rated for 50,000 miles, you will not get 50,000 miles out of that tire. You'll get maybe 35,000 miles, and then you'll be buying new tires, or you'll have a blowout of your tire. Your joints are exactly the same thing. If you've got 75 good years with your joints, if you start taking your joint and you start bending it and moving it in non-optimal positions, you take 75 years and you decrease it to maybe 60 years. And like I said, some of my clients, that are 13 and 14 years old that are already having osteoarthritis, they're decreasing their 75-year joint health to much, much less than that. So the important take-home message is be kind to your joints. Now, once upon a time, I shared this image last time. Once upon a time, we all had optimal alignment and control. And I love this picture. It's one of my favorite pictures. We love to show this to our clients. We love to show this to our patients. We looked like this at one time. And what I want you really to appreciate, and if you have grandchildren, if you have little nieces and nephews, if you have little people in your life, just watch them. It's like, it's so beautiful. We don't have children here. We have cats. We got to watch cats. But I love my cats, but it's not the same as watching children. It's so beautiful to watch what they do because they do what's inherently natural with their bodies. And you see this little girl playing with her toy cell phone, which, you know, will probably become a real cell phone within a few weeks to months. But you see the beautiful alignment of her head and neck over top her ribcage, over top her pelvis. You see the beautiful alignment of her head, her shoulder, and her hip. The beautiful alignment of her hip, knee, ankle, and foot. Most of us, almost all of us, look like this. We knew in our brains, in our nervous system, what to do. We weren't influenced by what people wanted to do with us or told us to do with posture and movement. We were dynamic and moving, exploring our environment, tasting things, looking at things, smelling things, putting things in our ears, walking, stumbling, exploring life. And then life got to us. Then our parents said, hey, and our teacher said, sit down for 8 hours a day at school and study. And then we got stuck in front of TVs. And then we got stuck in front of computers eventually. We took jobs that were sedentary. So we took what's natural and inherent to the body, and we created an entire different situation. That's why our joints started to take a beating. Because again, going back to what Dr. Wallace said, it's the quantity of physical activity. And as we were mentioning, it's also we lost the quality of physical activity as well. Because now most of us look like my client and patient here. We have some variation of this posture. And if you look at his posture, and what are the things that really notice? What do you really notice and stand out to you? What's the difference? What do you see happening with his head? Where's his head compared to his body? It's way far forward, right? Way far forward. What do you see happening with his rib cage? It's way far back that direction. So his head's going forward, his rib cage is coming back, and his belly gets sort of smushed down. And if you look at him, he just looks kind of smushed and compressed. That's what happens through life. We get smushed down by gravity. We get smushed down by the contraction of our muscles. We get smushed down by things that we carry, our children, groceries, packages, weight, things like that. And we lose the ability to be nice and long and stacked and aligned like the little babies and the little children that we once were. However, we can get ourselves, and maybe not 100% back here, but we can start moving ourselves so that we look a little bit more like we once did when we were children, and more importantly, feel better in our bodies as we do that. Now, what are some things that happened to us in our life that caused that? We mentioned the sedentary lifestyle. What are some other things that caused that? Well, we had injuries and surgeries and trauma. Julianne and Heather will probably have my wife Janice on at some point discussing the impact of surgery and trauma. How many of you don't need to raise your hand, but just kind of think about this. How many of you have had surgery, trauma, or broken bones? And even what we call, or doctors call minimally invasive surgeries. And how many of you had more than one surgery? The more surgeries you have, the more you develop scar tissue, the more you develop weaknesses, the more you develop tightnesses and compensations. So even little injuries can start to change our posture and movement. Sprained ankles, surgery on the ankle. Sprained knees, surgery on the knees. The wrong shoes. Last time we talked about shoes. And you see my client here. He's 65 years of age. He came in with foot pain. He's like, doc, my feet really hurt. I'm like, the first thing we got to change is we got to change those shoes. Look at the shoes. I mean, your foot is, so if you're watching me, just watch my screen. The foot should look like this. Does a shoe look like that? The shoe looks like what? This. And if you look at my client's foot, actually, I was in my last presentation, his foot is like this. It's actually shaped exactly to his foot. That's why the shoes you wear are so important. There's so many things that happen to us in our lives. I was a Catholic schoolboy, so we were a poor, lower middle class family. My parents struggled and worked hard. We had one income family. My dad worked, I barely saw him because he worked so much. to send us to Catholic school. I was put in shoes just like this as a little tiny kid. And we didn't have money to buy shoes every time my foot grew. So my foot got like this and I got claw toes, or, so where my toes start to claw under. Now for the last few years, now that I understand, I'm working on getting the foot to go longer and wider and to really use the foot more like a tripod. But again, I'm still working on it. 2 years I've been working on it. And it's still a struggle and a constant challenge for me to work on that. Because again, I spent how many years in Catholic school? 8 years of wearing these tiny little shoes when my foot was growing and developing. It was developing and growing right into the shape of the shoe. So I want you guys to just appreciate those things that changed our posture and our movement and our alignment that happened to us in our lives. Let me stop just for a moment because I've been talking a long time, so I apologize. I just been rambling on a little bit here. Does anybody have any questions? So pop on your volume and let me know. Let me know if you have any questions or anything that's coming up for you. I'd love to just have a little dialogue here.
Anybody?
Nothing?
I think Heather and I have talked a lot about this stuff with our clientele, actually. So you're hitting on all the right points.
I have a question.
Sure.
What do you think about flip-flops?
That's a good question coming from Florida, eh?
Uh-huh.
Here's what I'll say about
State shoe.
My wife loves flip-flops. She loves wearing her flip-flops. I don't think they're as bad as
picture went away.
I don't think flip-flops are as bad as some people say they are, but they can be bad for some people. And here's what I mean by that. Sometimes when people wear flip-flops, it does cause you to grip your toes to hold the flip-flop on, okay? So what happens is when your foot hits the ground, so you're walking, just say you're walking in bare feet. When your foot hits the ground,
I don't know. I can't get him back on.
Your foot hits the ground and spreads out. Sometimes with a flip-flop, it causes you to grip the flip-flop so it doesn't go flying off your foot.
I don't know.
If your feet don't do that, so what you could do is just have somebody watch you walk in them. If your foot's not gripping the flip-flop, flip-flops can actually be pretty good because they're pretty minimal and it allows your foot to spread out. So for some people, flip-flops are no problem at all. Does that make sense?
Okay. Yeah, it does. Thank you. I think just my big toe slightly.
Okay. Okay. So kind of just pay attention to that.
I don't know what I did.
Got it.
Also, real quick, what was the name of that sneaker that you showed on the last webinar?
Oh, yes. So the shoes that I wear, let me go see if I'm wearing them right now. It's Ultra, A-L-T-R-A. Let me go grab a pair. Let me show you what they look like.
One of my clients actually went and bought one after the webinar he saw.
If you leave it at the bottom, you don't need that. It didn't go.
Carolyn, are you having a problem with your video?
I am.
So go to the bottom of your screen
Yep.
and you'll see a video icon. And if there's a line through it, click on it.
No line.
All right, so you should be able to see us.
Okay. Okay. Hold on. It's
Okay.
coming.
We can actually see you, so we
Yeah.
can see you.
Oh,
As long as
that's
you can
lovely.
hear
It says to join meeting, and I'm hitting that, and it's not coming up.
Can you hear us okay, though?
I can hear.
Yeah, that's good.
Okay, so this is the Ultra
Okay.
shoe. If you look at the Ultra shoe, it's very wide at the base where your toes are so that your toes can spread out. Let me grab a different shoe. Let me show you another shoe, though.
And I generally wear, when I go, now this is for, if you've got real issues and you should be seeing a podiatrist, that's one thing.
That's one thing, right?
But if you don't, I never buy tennis shoes that I cannot twist.
Yep.
Because hard, rigid shoes, your foot can't move.
You see the difference? Which one looks like more like your foot? The one on the left, or this one here, or this one here? Which one can your toes and your foot spread out in? This one here. So this looks really good, and I love looking how this shoe looks, but it's not so great for my foot. Except, actually, it's okay for my foot because I buy it like a size or two too big, so my foot can actually spread out, and it still looks kind of fashionable. But this is more appropriate to your foot if you're wearing the right size shoe. Okay, you need a wide foot base, toe base. So you need a wide toe base in your shoes to keep your feet healthy.
And so for you, anybody that wears high heels is another very, very narrow platform. So it's okay maybe to go out for dinner, but not to consistently wear.
So yeah, my wife actually, just share one quick story before we get back to the presentation. My wife had bunions from the age of 11 or 12. When she was in high school playing sports, they wanted to break both her big toes, break both her small toes, and put screws in them to straighten them out. She's like, no way, because one, it'll suck to have that done because they're gonna do both sides at the same time, but she was gonna miss basketball season that season, so she didn't do it. When I first met her, she had painful bunions on her feet every single day, and especially when I would dance with her, because I'm not a great dancer and I would step on them, so that would be more painful. So I took her to my buddy, a chiropractor who's a specialist in the foot. He gave us exercises. She was diligent about working on the exercises every single day. I was watching her feet the other day, like literally just the other day, we're watching TV and her feet are spread out. I was like, holy cow, her toes are almost straight. But that's her being conscious of her feet, working on her feet, and wearing the appropriate shoes. When we go out to dinner, when we used to go out to dinner, she will wear her, sexy little shoes, and she'll wear shoes that, that she looks good in and that I appreciate. Well, her feet will hurt, and when she comes home and the next day, then she's doing all her exercises to spread her foot back out and get it back out to where it belongs. So it's not saying that you can also do the same thing, but what it is saying is we should all strive to do foot exercises so that our feet can function better. Okay? Good. All right, let me share the screen. We'll finish up here.
Problem is I can't see.
Could you actually mute yourself? Because we can actually, maybe I can mute you. Actually, I got you muted. You're good. Cool. Okay, so life happened to us. Remember, responsibility is the price of freedom. You are responsible for your body, and we truly appreciate you seeking experts out like Julianne and Heather, because many people give the doctor the responsibility. Hey, doc, what can you do for me? What medication can I take? What surgery can I do? What physical therapy can I do? What massage can I have? And all that may be necessary and appropriate. So I'm not saying you don't need medication or surgery. I'm not saying that at all. But remember that the responsibility of your body, ultimately, your health, ultimately falls back on you. So you made a great decision to work with an integrative movement specialist like Julianne and Heather. So the principles of the integrative movement system come from what we all did, as we talked about, like my little niece did here, 6 months of age. I love these pictures because it illustrates everything that we're supposed to do with our bodies, or not everything, but many things. You see her in this little happy baby position. It's called happy baby because they're a happy baby in that position. Beautiful alignment of her head and rib cage and spine. Here she is planking. She's doing a plank on my chest. Look at that beautiful alignment of her core, of her head and neck. I love that picture. And that way she's starting to become she'll turn 10 this year. So I just want to make sure if she ever gets to be that little teenage brat, I'm going to tell her, you used to like and love your Uncle Evan. We used to hang out. So I'm going to remind her of that. And then you see her, she's learning how to pull herself up. Do you see how beautifully aligned her rib cage and spine are, hip, knee, ankle, and foot are? We were all like that at one point, most of us. We can all do things that can help us move closer to that. Those three things that I know Heather and Julianne have drilled this into you. They're the ABCs, the principles of the integrative movement system. Align, breathe, control. When you align, breathe, and control, you take responsibility, you give yourself strategy. To us, the ABCs is like giving sunlight and water to a plant. It's what allows a plant to blossom and bear fruit and be a healthy plant. We believe that when you align, breathe, and control, it's the same components that allow you to express your posture, your movement, your vitality. When you compromise alignment, when you compromise breathing, we talked about that last time. When you compromise control, it's like that plant that doesn't have enough sunlight or enough water. it's going to wither. It's going to wilter. It won't give out its full bounty of fruit or vegetables, or blossoms. So it's a good little analogy to think of your body like a vibrant plant, because it's an alive being. Now, we talked about healthy feet. Here's an image about healthy feet. Here's a little baby's foot, and here's a healthy adult foot. A healthy adult foot looks very similar to this. You see how it's wider at the top in the front than in the heel. If you look at a lot of clients, a lot of people that come in to see me for foot problems, what do their feet look like? They look like this. It looks like the same width all the way down. It looks like this, the width of their shoe, the shoes they've been wearing their entire life. You want wide feet, long toes. And you want some gentle arches. You don't want to be completely flat. You want gentle arches. Now, again, many of us that are watching this, many of you that are watching this, maybe you've already lost your arches, or maybe your foot is, you've had surgery on your feet, or you have bunions and things like that. That's okay. Some of that you won't be able to undo. But what you can do is you still have muscles in your feet. Your brain knows that there's muscles down there. What we want to do is help you wake up those muscles. So we'll talk about that before we get out of here as well. So your knees and feet. Your feet are some of your knees' best friends. If you look at my client's feet here, do you see how the little baby, knees and feet are aligned? My client here, you see how her knees and feet are aligned? And that straight line, remember that I said the straight line, it's not straight vertical like this, it's slightly angled. It's still a straight line though, coming from her knee down through her big toe. Your knee should not go inside your big toe. It shouldn't go way far outside towards your fifth toe or your little toe. It should stay somewhere angled and aligned over top your big toe. And I know, again, your specialists have talked to you about that and helped you achieve better alignment. Your hips should also be aligned excuse me. I've been talking a lot this morning. So, I apologize for that. Take a sip of water here. Your hips, knees, ankle, and feet should be aligned. But remember, it's not a straight vertical angle. It's a straight line that's slightly angled, where the knee is going through the big toe towards the big toe side of the foot. The pelvis stays level. When you squat, your hips, knees, ankles, and feet should also be aligned. You should be able to use your glutes and your hips. We'll talk about that here briefly before we go as well. Now, here's my client. Let me minimize the screen here. Here's my client. Tell me which side does not look very well aligned. So that would be her left side. I'm going to draw a line on her right side. So you see the line we were talking about. You see, this is a straight line. She's got some issues on her right side, but again, it's not bad. Her hip here, where the pointer of the stick is, the line is, I should say, comes down through her knee and comes through her big toe. That's about where it should be. It could be a little bit better, but that's okay. I can live with that. She can live with that. Now, if you look at the other side, I'm going to draw the same straight line and look where it lands on her foot. You see how it lands inside her foot, way inside her foot. That's what causes knee problems, or one of the things that causes knee problems. That's one of the things that causes bunion problems. It's your shoes, and it's how you're aligning your hip, your knee, your ankle, and foot. Your key to health and longevity is the principles: alignment, breathing, and control. I'm going to stop screen share. So now, any questions about anything we've talked about so far? You guys can unmute yourself and go ahead. Any questions?
Thank you, Tom.
I think you're covering it pretty well.
Yeah.
Yeah, I have a question for you, Julianne and Heather. How have I done so far? Have I actually do I know what I'm talking about? Like
Just a little bit.
No, you're doing great.
Absolutely.
I just want to make sure I'm saying stuff right, because sometimes I get carried away and then I start saying stuff. I'm like, Janice is like, "What did you say?"
No, no,
Okay.
it's all in a very good order. I think everybody's understanding it very well. And most people that have joined us have trained with us for a while.
Okay, yeah, yeah.
Some of you have not. Some of you are new. We appreciate your open-mindedness. But
For sure.
absolutely, the way that you're presenting makes a lot of sense.
Good.
I have a question.
Yeah, for sure.
So when it comes to the knee not being in line, I don't know if you can answer this right.
Yeah.
Would you say it's more related to injury or habits, or does it just both of them?
I think it's a little bit of both. I think it's when you put your feet in shoes that are too narrow, your foot can't spread out. So what happens is your foot becomes very stiff and rigid because it's too small. So what happens is when you start walking, your knee can't go over your foot and it starts going inside your foot. So it's habits like that. It could be an injury where now you start limping on one side. Like, you know, a lot of people sprain an ankle. How many of you listening to this have sprained an ankle or an ankle multiple times? We all have. So what happens is sometimes that changes the tissue, the muscles, the ligaments, the connective tissue, and it overstretches some connective tissue. It makes other connective tissues short and tight. So what happens is the injury heals, but the tissues aren't the right length. And now you start changing and compensating around that. When you guys have Janice on, she'll talk about surgeries, and all surgeries do three things. All surgeries will create compensation. All surgeries create scar tissue, and all surgeries will create weakness, which ultimately then lead back to compensations. And it doesn't matter how little the scar is on the surface, it's what's happening underneath inside of your body that ultimately impacts you. If you think about when you cut your hand, say you're cutting food, and you cut your hand, you're like, oh, that hurts. You see the scar tissue that forms on your hand, and ultimately that's what heals you. Well, think about when you're doing minimally invasive surgery. You say, oh, I only have 3 dots in there on my stomach. But inside, that's not what happens. They use those 3 dots to put their tools inside you, and then they start cutting things inside, right? And that is also forming scar tissue, just like your hand. But what happens with scar tissue is if you think about your muscles, and your muscles like this, your muscles have fibers that run through them. If you can think of like a telephone cord or telephone wire, the telephone pole outside, you see those wires and they run all parallel to each other. But when you have scar tissue, when it heals, it doesn't heal like this. It heals like this. And now that scar tissue, here, if you guys are watching me, do this with me. Watch my shirt. So now, say you had abdominal surgery, right, on one side. And now, just grab your shirt and start to pull your shirt like this. Pull it tight. And you can see on my shirt, you see how the lines on my shirt are going this direction and down this direction? You can have 3 little tiny holes if you had minimally invasive or laparoscopic surgery, but inside you have scar tissue that's pulling you, and then you wonder why is my right shoulder hurting, or my left shoulder, or whichever side you're looking at. Why is my shoulder hurting? It's because this tightness here is pulling everything down. So it's causing these compensations that you don't understand until you work with a specialist like Julianne or Heather. Your doctor doesn't understand that. Your doctor's not educated on this. And again, this is not, you know, it may sound like I'm trying to bash the medical field, but I'm really not. I'm just trying to educate you as a consumer. You have to understand that we all have our specialties. Doctors, surgeons, they're awesome at surgery. If you have a tumor and you need a tumor removed, they are awesome at removing tumors. And I'm so glad of our surgeons. We're dealing with COVID right now. We've got excellent doctors and researchers and nurses that are all front line, all these frontline people. You know, if you guys know anybody, please thank them for us. They're doing wonderful work understanding it and dealing with the virus. But we all have our expertise, and they're not experts on muscles. They're not experts on scar tissue. They're not experts on posture and movement. And that's why we train people like Julianne and Heather to be those experts on posture, on movement, on understanding what happens after surgery or trauma or injury, and from a history of these types of habits. I really hope that makes sense, because you need lots of medical professionals, because everybody has their specialty. I don't know about teeth. I go to my dentist because he knows about teeth. You know, I don't know about, you know, colonoscopy, right? So I'm going to my doctor here, and well, as soon as we get back, you know, I'm 50 years of age now, so I need a colonoscopy. I'm going to go to my internist who understands the GI system. That's not my expertise. My expertise is posture. My expertise is movement. My expertise is understanding what happens to the body and the compensations, and more importantly, what to teach people to do about those issues.
So, Dr. Osar, I do have a couple of questions, if I
Sure.
can, from a client that's on.
Sure.
You spoke about a product last week, Comfort Toes.
Yes.
That was to spread the toes, yes?
Yes.
Could you talk about that briefly, please?
I will. So about back in February, I was speaking at the Medical Fitness Conference out in Irvine, California. I've worked with a lot of podiatrists over the years, and frankly, I have not met one that has impressed me and that I feel comfortable talking to and or referring to. And it's been very disappointing for me because they're experts and specialists in the feet, but most of them, they don't look at the foot the way we look at the foot. I was fortunate to, I did the keynote speech, and then I saw this Dr. Ray McClanahan speak. He was a podiatrist from, I believe, Portland, Oregon. And it was the first podiatrist speak where I'm like, oh my God, this guy gets it. He told me, he explained to us that he used to do tons of bunion surgeries, tons of surgeries on the feet, put tons of people in orthotics. And he says, now about 5 to 10% max have surgery or have bunions. And he created this product called Correct Toes. So I'm gonna hold this up here. Just go to Correct Toes, their website. There's lots of information there. Now, to tell you, number one, I do not make any money by telling you this. I'm just sharing information, okay? Number two, I am not telling you that this is appropriate for you. So don't go get it and say, Dr. Osar told me to get Correct Toes. No, I didn't say that. Go to this site and educate yourself. Dr. Ray McClanahan is very similar to us, and we resonated. We're gonna be starting to do some education together because he gives out tons of free information. And if you go to his website, there's tons of free education for you on the website, and it'll resonate with everything we're sharing here and everything that Julianne and Heather are sharing with you as well. I'm currently using these right now. My wife is using them as well. I love them. I absolutely love them. But again, I just want to please share that do not go use them before doing your due diligence, before asking your own health and medical professional if they're appropriate for you. But go to the website, educate yourself, so that way you can then go to your podiatrist or your chiropractor or your medical doctor and ask them if it's appropriate for you. And if you do find that this is appropriate for you, the problem is you can't wear them in shoes that are not like ultra shoes because the shoe is too narrow. You need to wear them in bare feet and get the appropriate shoes. But again, ask your medical professional first before using this or any other recommendations that I have talked about on this webinar.
Okay, thank you. And then the second question is, what about essential tremors? Is that genetic?
Again,
or is that out of the scope of this?
Yeah, that's out of the scope of my practice. So I am not the expert on tremors, so I cannot comment on that. I apologize for that. But again, I'll speak with a neurologist because they are experts on those sort of conditions, and I would defer to them. So again, say when clients come in with multiple sclerosis or Parkinson's, which we have quite a few here, we refer them out. They already have neurologists, but if they didn't, we would refer them out to a neurologist. For example, a gentleman flew in to see me, and he said he'd been working with me for a few times. He'd fly in to see me. He flew in one time, or he emailed me. He's like, Doc, you know, I'm starting to get some weakness in my glutes, so or my ability to stand on one leg. So he flew in to see me. We looked at him, and I'm like, something's not right here. Let me do an MRI on your low back. So I sent him for an MRI. Came back. He had some disc herniations and some issues like that. I'm like, it can kind of explain it. We did some stuff, and he felt better. He's like, oh, I feel stronger. I feel more stable. Then he emailed me a couple weeks later. He's like, Doc, I just want to give you a heads up. Now I'm having weakness in both legs. And all of a sudden, a red flag started going off in my head. I'm like, this is not good. I'm like, you need to see a neurologist. That is not a typical disc problem. That's not a typical manifestation of neurological type issues that I'm equipped to deal with. He went to see a neurologist, and unfortunately, he was sorry. Sorry.
It's okay. We can get a little emotional when it comes to people that we work with, for sure.
He was diagnosed with ALS, and he passed away.
So sorry to hear that.
Sorry.
But you know, there's a scope of practice, and if you have tremors or something like that, that's in your neurologist's scope of practice. I apologize for that.
That's okay. We all get a little emotional when we get close to people, so it's what we do. So we take on, you know, so, but again, those are beyond the scope of this webinar and very detailed questions, right? So
Yeah.
but anyway, the alignment is really important, as Dr. Osar has stated, and your feet, of course, and the shoes that you wear, and all of that ties in together with what your lifestyle, what you've been through, basically, whether it be surgery, sports, bad posture, the way you sit, the way you move, it all adds up. But it's never too late to change, and that's what we're all about.
It's never too late to make and to start adopting healthy habits, and that's really, I hope that's the message you guys take home from here, that it's never too late. Julianne, please share the story. I know you've probably shared it with your community, but I think it bears repeating. Can you share the story about your client that you were teaching her the breathing, and you were asking her about her incontinence? Can you share that story? Just
Oh, yeah.
Just the power of changing habits, small, simple habits.
So when I was going through my IMS training a few years ago, my oldest client, I could this type of every leg of the training, we had to actually work with an individual and apply the information that we were learning. I had to send Dr. Osar and Janice the videos, do all the homework and all of that. So I happened my oldest female client at the time, I decided to bring her in on one leg of the training. And she said to me, "Why me?" I said, "Well, because you're important." I mean, in a way, now you're going to get me emotional. So, and she's a very private individual, doesn't really share too much. Well, what she shared with me, by the end of the leg, so you're actually taking 4 weeks with an individual and applying. So her big changes in that 4 weeks was her rib cage alignment and her breathing. And we didn't even really, we were just doing 3-dimensional breathing and some other things, some releases, activation exercise. And by the end of the month, you know, and she's all proud that she gets to, you know, have me send her stuff in to Dr. Osar and Janice. So by the end of 4 weeks comes, so in the 5th week, you know, she says to me, "Well, I want to tell you something." And I said, "Okay." She said, "Well,"
this is so great.
She said, "You know, I had a little problem." I said, "Oh, did not know that." She said, "Well, you know, 3 weeks into it, I was only using one pad, I think it was, in a 24-hour period. And then the 4th week, no, she went down to 2 pads a day. And then the 4th week, she went down to 1 pad a day. And she said, "This week I forgot to wear one and I don't have any issues." I'm like, wow, that's pretty awesome. almost 90 years old, and we stopped incontinence altogether. And so it was about probably 4 months ago, I asked the individual, you know, where are you? Are you still in, you know, okay, you're not incontinent? She said, yeah, I'm still okay. Don't have to wear a pad. And we weren't even doing the detailed pelvic floor breathing or exercises that are actually for an individual. You know, this is just regular 3-dimensional breathing. If I had somebody come to me for pelvic floor training, there's much more detailed breathing and exercise that I would do with that individual, but that's not, you know, when you're that age, or I think women in particular are conditioned to, oh, that's just an age thing. You know, you see the commercials on TV, it's acceptable.
It's
So
acceptable,
just buy the Depends and or Poise, and you're good to go. And it's an age thing. And so it was really, really awesome. And so you don't have to be afraid to go out to the store and have to have a bathroom nearby or anything like that. So it's pretty powerful stuff, and amazing.
So 2 things I just want to leave you with, and then I got to run, is number 1, don't ever give up hope. There's always hope. And even if you have the worst of conditions, even my client that had ALS that passed away, as long as I could see him, he still came, and we were still able to create changes. He's like, Dr. Osar, you've helped me so much. And even though obviously I could not help him save his life, or nobody could, he still worked on his posture and movement. He's like, it helps me as much as anything can help me at this point. So, and with your story, Julianne, beautifully illustrates the power of these simple principles of alignment, breathing, and control, and just doing consistent, taking responsibility, doing consistent work, taking responsibility, and just having faith that what you're doing is ultimately going to result in more optimal habits and help you live a better life, a more fulfilled life, and sustain health and longevity and viability. Just really be that dynamic person that I know that you can be, and that you probably feel that you can be, which is why you chose to work with Heather and Julianne. So I want to thank all of you for being on, for giving me this opportunity to share this very important message with you, for allowing me for my little breakdown there. And you know, Julianne and Heather, I want to thank you for all you do for your community, because you are transforming people's lives with this information. And Janice, my wife, myself, Sarah, and our IMS community is so grateful for the work that you guys are doing and spreading that message to your communities down there.
Well,
Couldn't do
we're
without
really
you.
thankful for you, and thank you so much. And my one client texted me, Julianne, Dr. Osar is awesome. We agree. So thank you for your very valuable time. We appreciate it. And thank you all for joining us this morning. We appreciate your time as well. And because we know you could be doing other things, but you chose to be with us this morning. And hopefully you got some good information. And we look forward to the next time.
And last parting thought, do what those ladies tell you to do. Thanks, guys.
Thank you. That was awesome.
Thank you so much. Happy Saturday.
Thank you so much, everyone.
well.
Thank you, Dr. Osar.
Peace and love to your communities.
You too.
Thank you.
Stay safe.